Hi, my name's Kathy Linville. I'm with Laerdal Medical. I'm here at Master Medical Equipment today to talk a little bit about our Resuscitation QCPR Manikin. She is part of a family. We also have a Resusci Junior and a Resusci Baby. Resuscitation happens to be one of our more popular training mannequins for the pre-hospital folks out there. She's able to be intubated with any adjunct, both oral and nasopharyngeal. You're also able to measure your CPR response in measurements for rate, depth, and recoil. And then when you add your BVM or your airway adjunct, you can actually dial in the tidal volume that you would like to deliver. And that tells you whether you're over or under or delivering the tidal volume that you recommend per your protocol. We also have the Simpad here, and this is a simulated operating system for training. It is ran with the Simpad. I'm going to make some changes here on the Simpad, particularly in my CO2. I'm going to change my waveform as well as my measurement, and I'm going to activate that. You'll be able to see that appear here on your monitor. So you can use this for a standardized patient, a static mannequin. A lot of times we use it in conjunction with our training mannequins, such as the Resuscitation. Hi, I brought in Trent from Master Medical Equipment. He's going to help me show you the airway in Resuscitation and some of our airway adjuncts that we have. Trent, you want to go ahead and
Sure.
intubate with your video laryngoscope?
So that we can see the airway.
Yeah.
We just brought in a little VL.
And again, you can use any adjunct that is approved by your policy protocol. Slipped right in.
And then we will
And now we're going to secure it with
use
the Thomas
tube holder.
Yeah. These are pretty easy to get in here, secure, and then come around. Within seconds, you have your ET tube secure. I guess I should have been bagging, Trent, huh?
Well, with this Laerdal BVM, get a good nice chest rise there.
Yeah. My favorite thing about the BVM is the handle.
Yes, I love the handle.
I have to have a handle.
And also the ability to decrease the volume
Yes,
if needed,
absolutely.
so that we're not delivering too much volume to our patient.
Thanks, Trent.
Awesome.
Trent and I are here to show you exactly how you can build out Resuscitation to a full body mannequin. A lot of times these mannequins, the way they are, just the torso, are perfect for your QCPR training. They're easy, they're lightweight, and can transport anywhere that you need training. But if you require a full body mannequin, you can actually add arms. This is an IV arm. Just slips in here like this. It's on. You have your IV, and this one's kind of set up with the drain bag that goes down below, and then you would actually fill this with simulated blood, and then you're able to actually perform IV function on this arm and start an IV and run an IV, and then once the drain bag fills, you flip it and you're ready to go again. And then you're also able to equip this with hard legs. Very easy to put in here. You just take the stomach bladder out. There's a little pin right here. Slide that in. Just there we go. Put the stomach bladder back in. And here we go. So a little bit about these legs. This is our gunshot leg right here. You can run external blood through here. And then you're able to either pack this wound, because it is a through and through wound. You fill in there, Trent, you can feel a little bit of bone fragments But if you want to do a tourniquet, you actually tourniquet, and there's a little hard piece here. If we can see this, there is the tubing that runs exterior blood, goes through here, runs out into the wound, and then when you tourniquet this, you're able to actually put enough pressure to actually cut and clamp that blood tubing off, and so your bleeding stops. Moving on to the second leg, this is an actual IO leg, but you also have the ability to do IM here on the lateral portion of the leg. The IO actually would have a drain coming out the back here, and very similar to the IV, you could actually drill and start infusing medicine and drugs and have that drain bag in the back, as well as your IV here in the front. I also would like to talk about this little device. It would go internally if you wanted to use a ventilator on Resuscitation. It will adapt and allow the lungs not to overinflate and blow up with ventilator volumes. Very easy, and there will be a video on that as well. So I'm back with Trent, and Trent has volunteered to do some chest compressions here on Resuscitation. We use Resuscitation a lot in high performance team CPR as well as individual skills. Today, Trent is going to do just chest compressions for us to start off.
All right, good.
Yep, I'm good. So what you can see now is Chest is doing some chest compressions here on the table, a little difficult. He is doing great, except if you see this little accelerator here, it looks like your speedometer. He's going a little slow. It needs to really be in that green section. And if he doesn't come completely, his chest place, or his hand placement, sorry, is a little off. So he's going to readjust, and that green indicated it's all good. So if he doesn't compress all the way down, because he's doing really good chest compressions right now, he's not really going deep enough. It's going to indicate that with a yellow arrow down. And then when he corrects himself, or an instructor corrects him, that is going to turn green again. If he doesn't come completely up off the chest, a full release, you're going to see that yellow, upward yellow arrow, indicating that he needs to come completely up off the chest. And that is Resuscitation with Simpad Skill Reporter.
All right.
So Trent's going to demonstrate our ventilations. You can exercise your ventilation practice separately, or you can incorporate this with the entire QCPR logarithm to include chest compressions. Right now, Trent is doing really well in bagging, a little fast. Again, we have the speedometer that actually shows we want to deliver between 6 and 8 breaths per minute. So he needs to be in that blue area with the speedometer. But then the bars, the blue bars that are coming up and down, are actually your volume. And so he's hitting volume every time. If he underventilates or overventilates, that bar will turn yellow and indicate that he has given too much or too little volume. There we go. So he has under-delivered and over-delivered a couple of breaths. And that's the ventilation portion of the QCPR. Thanks for joining Trent and I today as we discussed Resuscitation QCPR. Thanks for watching, and if you have any other questions, please contact Master Medical Equipment.
And if you like the content that you saw today, smash that like button for us. Thanks.